Hello and welcome. This is Joe Valenzuela with Vista Mutual Insurance Services. Let's talk about how you can save money if you're a Medicare recipient on a Part D plan. Well, the first way that you can potentially save money is by looking at the plan benefits and what the plan covers. See, each Part D plan has a list of covered medications or formulary that just shows you what it covers. And we as insurance agents can look this up for you, tell you exactly how much you'll pay for each medication with each plan, and then map out your year for you as well. So the first thing to do is speak with an insurance agent that's licensed and certified to sell these products and go over your situation. It can be a wild difference between premiums and drug copayments between all these companies. So if you're trying to do this yourself, it can be a little bit difficult to find out which one is the best benefit. And not the best overall, but the best for you, the best for your individual needs. We can't really say the word best in the Medicare insurance world, but best for your needs is definitely something we can. Now, you want to consider all your avenues for getting prescription drug plans. So if you have a standalone prescription drug plan, it's usually going to be less robust than a Medicare Advantage plan with a prescription drug plan built into it. And that's just kind of the way the reimbursement works through Medicare. So if you're on a standalone prescription drug plan that just covers medications, you're going to have higher copayments. It's not going to cover as many medications as potentially a Medicare Advantage plan with that same prescription drug benefit built into it. They just get more subsidy from the government for these, so they can add more benefits. Now, a Medicare Advantage plan with prescription drugs is basically a health plan and a prescription drug plan combined. Okay? So if you're paying a lot per month for your medications and you have a standalone prescription drug plan or a standalone prescription drug plan with a Medicare supplement, you may want to look into Medicare Advantage plans with Part D plans built into them in this upcoming annual election period, because you can make a change between October 15th and December 7th of every single year. All right. Also, you want to compare the prices between different pharmacies. And this is one that's often overlooked, but Part D plans can have preferred and non-preferred pharmacies. So you get a lower of a cost for going to their preferred pharmacy. So for instance, if you like Walmart or CVS or Walgreens, and this is the place that you want to go for your pharmacy, you know the pharmacist, they know you guys have a great relationship, you talk about your fishing trips, things like that, you're going to want to select a plan that has that as a preferred pharmacy. Or you're going to pay a higher cost just for going to the pharmacy that you love. And we can do this for you as well. We can look up all the preferred pharmacies for your plan. Now there's another way to save money and modify your current and existing program, and that's by trying to qualify for Medi-Cal. That's what it's called here in California, my home state, but it's called Medicaid in other states. And it's a income and asset program, so people with lower income and assets can qualify. They have to go through Social Security or Medi-Cal or Medicaid itself to try to qualify. But if you do, it can modify your prescription drug program. It can pay your Part D premium. It can also pay your Medicare Part B premium and then lower your prescription drug cost down to $1 to $8 or even $0. So it's a great program. Now there's a separate program other than this called the Extra Help program. And if you don't qualify for Medi-Cal or Medicaid, you may want to try to apply for Extra Help. The Extra Help program has higher income and asset qualifications than Medi-Cal. So you might qualify for it. And it still will pay your Part D premium, pay your Part B premium, and modify your plan so you don't have a deductible, a coverage gap, and you don't pay more than $8. This all depends on which level of subsidy that you can get. So we highly recommend that people qualify or try to qualify for that program. The worst that can happen is they say, you don't qualify, and you're back in the same situation that you had. The best thing is they can cover all those values and lower everything for you. So try to qualify. You're also going to want to look at generic medications. Now, there are some medications that are only brand name and they do not offer them in generic yet. We understand that. Sometimes, though, there might be a generic alternative that covers the same class of medications. And everything I'm saying, of course, you need to talk with your specific provider about, your doctor, to find out if these are a viable option for you. So there are some differences between generic and brand name medications. Mainly, the active ingredient can have a certain percentage of swing. The binders and the fillers are different. So we understand that some people have a negative reaction to generics as well, but it's always good to try. Talk to your doctor, see if you can switch over to a generic, and you're going to save yourself a lot of money. Another way to save some money on your prescriptions is an often overlooked one, but if you're okay with it, if you're able to use a mail order pharmacy, then you're going to save money per month on your prescriptions. Oftentimes, Part D plans will offer incentives for going through the mail. They'll give you 2 months copay for 3 months supply, or generic medications for no copayment. So if you're able to go through the mail, then you're going to save some money. However, there is a caveat here. We do recommend that you have about 3 weeks of prescription medications on hand before you start the mail order process. The first fill can take up to that long to get to you. After that, they're usually pretty good about automatic refills or calling you to request your refills and getting your medications to you on time. So mail order pharmacies can be a great resource for instant savings. Another way that you can potentially save some money is to ask your doctor. If you ask your doctor if there are any clinical trials, because there are some very expensive medications. Very expensive. We're talking for chemotherapy, immunotherapy, or ALS, like Radicava, that are incredibly expensive. So if you qualify for those extra help or Medi-Cal programs, it reduces all of those. But there are also clinical trials for these things. So you need to ask your provider, if you can't afford these, if a clinical trial may be a viable option for you. They will provide those medications at no cost to you, and it doesn't apply to your plan, which means that you could potentially save yourself from reaching the coverage gap. And what is the coverage gap? Well, Part D is created, or the government, CMS, the Center for Medicare and Medicaid Services, creates the standard plan. So the model looks like this, and each plan, a private insurance company, has to be at least as good as that, if not better. Usually they're better. But inside of that standard model, there is a thing called a coverage gap or donut hole. You may have heard these terms before, and how it works is very simple. The values shift and change all the time, but think about it this way. Your medication costs a certain amount. Let's say you have a medication that costs you $1,000 or retails for $1,000. Now, in the beginning of the year, you may not be paying the full $1,000. You may have a $47 copayment for this $1,000 medication. But if your total cost, so what you're paying plus what the company's paying, reaches a certain value, then you get into the coverage gap. Once you're in the coverage gap, you're responsible for 25% of the total cost. So that same medication that was $47 just went up to $250 per month. This hits a lot of people. So if it does hit you, you'll basically you'll want to make sure that you can have every possible way to get out of it. Right? If it hits you and you have $1,000 prescription and now it's turned into $250, that could be until the end of the year, right? Or it could be only until you reach the other side, the catastrophic coverage limit. Now, during this time where you're paying the $250 in the coverage gap, the insurance company is paying most of the other amount. Now, both of these amounts count as money that you're spending to get out of the coverage gap. So when you hit this other level, you get out of the coverage gap and you pay no more than 5% for your medications. But on a $1,000 medication, that can still be pretty expensive. And some of these medications can be $10,000. So that's how the coverage gap works. Luckily, in about 2 years or so, if all the laws remain the same, you'll have a maximum out of pocket, so a stop loss, a cap on your prescription drug side as well. So that's going to help a lot of people. Okay. There are also certain instances where the discount drug programs may work, like GoodRx or these other discounts that just pharmacies give you. You'll have to check with them to see if they coordinate with Medicare plans, and some do and some don't. So there are those discount programs out there too, and those can help just on a one-off basis. You may also even want to consider purchasing over-the-counter medications that do the same thing that your prescription medications do. One of the examples that I can give in this category is for acid reflux. There are a lot of prescription medications for this, and there are a lot of over-the-counter medications for this. Now, you want to talk to your doctor, of course, But if you can talk to them and they say that, yeah, you can take the over-the-counter one, it should be fine, and it's 10 times less and doesn't count towards all these coverage gap and initial coverage limit values for your Part D plan, then all the better. So look into those over-the-counter alternative medications. Now, there's also a thing where you can look into your state pharmaceutical assistance programs. So there are manufacturers for all of these medications. Big ones like Eli Lilly and Pfizer and all these people, right? If you're able to identify the manufacturer of your medication, very simple, just do a Google search, then you can either get into the pharmaceutical assistance or the patient assistance program for that company. There's, again, asset and income qualifications and diagnosis qualifications, but if you qualify, they send you the prescription for no cost to you. And again, it doesn't go towards those values. You don't pay anything for it. So it's a process, but we can guide you through that process and help you to get to what you need. There are also other organizations like churches and community organizations, even city and county organizations that can help. They're hard to find, but again, that's why we exist. We know about all these local things so that we can help you save money. So you can reach out to one of us. You can do Google searches too, or search on Medicare for different pharmacy or medication assistance programs. And there are tons out there. So there are many, many ways that you can save using your existing Part D coverage. There are tons of people out there that have really high costing medications and get hit with the coverage gap every single year. And we hate to see you in a position where you have to choose between feeding yourself or giving yourself the medications that help you survive. So it's important to talk with an expert like us. We're absolutely no cost to you. We don't get paid until we sell something to you. And all the companies for Part D pay the exact same, so there's no bias. We have a system that can input all of your medications, tell you which ones are covered, tell you the generic alternatives, map out the entire year for you to show you exactly what you'll pay so that you'll never have any surprises. Now, we do this to provide value to you, and hopefully you found this video informative. Follow us for more Medicare tips and information on how to save money and get the most out of your benefits. Thanks so much. Again, I'm Joe Valenzuela with Vista Mutual Insurance Services. Have a great rest of your day.